we're going to go ahead and get started. I just want to welcome everyone. Thank you for joining us today. Our Luis has posted in the chat there the agenda, and there you go. So the first item of business is the approval of the minutes from our April 21st meeting, which Luis sent out yesterday. Can I get a motion for approval if there are no edits or comments?
I move to approve.
Great. Can I get a second on that?
I'll second it.
Great. All those in favor?
Aye.
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 Thank you again, Luis. Great job. And now we're gonna invite Gabino and Sarah, if you'd like to give any updates as well following Gabino's update. We'd love to hear from you too. So
Yeah,
Okay.
well, Sarah's going to give my update.
I am. Okay.
So Sarah, why don't you start with the county information and then I'll fill in the blanks.
Okay, no problem.
All right.
Dale.
Great.
Good morning, everybody, once again.
Good morning.
Sara Rivera here, Health Equity Manager for Ventura County Public Health. We have 55,000 tests, at-home tests, and they are available. We have communicated to our VCCF partners for the last 2 Mondays what the process is. If anybody's interested, they can definitely email me to find out more information on how. If you are a community business organization, you can reach out to me or Rodrigo Cardenas to submit your request. These come in cases of 300. They are individually packaged, and that's so that a person who needs one test doesn't have another one and discards it. So it's a much better use of our supply. And this supply is meant for people who are unable to purchase these tests. These are available everywhere, but they range in price from $17 to $25. And so for people who are uninsured, are not able to make this purchase at this time, but they need it. They are a community where resources and vaccine acceptance is low, then this is where we want to be. So 930-31, all of Santa Clara Valley, and some parts of Simi Valley, small pockets in Thousand Oaks and in Camarillo. Those are the places where we would like the supply to go. The next update that I can share with you is that in partnership with CDR, I wanted to spell out your acronym, Child Development Resources, and I got stuck for a little bit. And also Community Church Revive. We have been able to deploy some podcasts, videos in Spanish and in English that are meant to inform and inspire in our community the what's next and how do we proceed and how do we continue staying safe without just if we come in contact with what do we do, what are our options. So they are educational, but also meant to inspire and motivate us moving forwards towards a safe and healthy future. And so thank you all of you here for helping us with that. So that's what we have. The other item that I would like to share is that in our conversations with promotoras de salud that are working in various communities throughout the county of Ventura, they have identified that what would be useful for them is to have a guide with bulleted points that if in their conversation or engagement with the community, they find that this is what they need, that they touch on a certain topic and they need more information or resource, that they can just turn this half sheet page instead of having long, very wordy and full of text handouts, that they can just have something that is simple, that they can use as a tool to engage people and inform them. So may I share my screen with you so that I can show you what's coming? So our Jackie Nunez I can try again. It says that I'm not able to.
Oh, Sarah, let me go ahead and make you a co-host.
Okay, thank you.
That should solve that.
Thank you.
Okay, try that.
So this is something that is in print right now, and it's available in Spanish and in English, but it's a half-page type of handout, so that as we are talking to people in the community, we can say, have you gotten vaccinated or boosted? Do you feel like you need to wear a mask? If so, is it a safe and a strong, a good type of mask? Have you tested positive? Do you feel sick? These are the things that you may do. Do you need a test? And did you test positive? Do you need a treatment? How are you doing in your home? Are you keeping in mind that windows should be open, especially when there's more than one person or more than one family and living in one household? And so if the person says yes to any of those, then the promotora or the person that's providing the messaging can turn this page to the backside and say, these are the numbers, these are the places, and it has just more detail as to what the person can do. Some people are open immediately to more details. They think logically, they want substance, something that they can do. Other people want us to empathize with them and to just be understanding. So it provides that opportunity. So this is coming. It will be available. We would like community business organizations throughout the county to just let us know how many copies they need, and our vaccine equity initiative will be happy to provide these. So that is my update. Thank you.
Very good information, Sara. We appreciate all the efforts. And I love the simplicity and how we can use it as a tool to engage conversation in the community. So thank you so much.
You're welcome.
Y Sara, ¿está eso en español también? ¿Ya?
Yes.
¿Listo? Okay. All right. Y también acerca de los, let me switch. Regarding the test, ¿verdad? Are they open to, are they available to anybody who would need them, like any organization?
If it's a nonprofit organization, yes, it's open to them. We are open. I think that as we get requests, we will consider them. We will talk to them, and we will see how we can work something out.
Okay, because you know, Olga, quisiera usted dar un comentario acerca de eso.
Sí, buenos días. I'm sorry. Good morning. Yeah, well, I reached out to Dr. Gavino because I'm in a nonprofit organization and they're not participating. So I was looking for somebody to I guess, how should I say it? Sponsor me so I can is that the word, so that I can distribute the tests to the community that needs it, like Sarah was saying. Yeah, we know that some organizations are not participating. Maybe they don't know, you know, that they can't participate. I'm not too sure as why, you know, they're not participating in this. So, but thank you, Dr. Gavino, for, you know, supporting me and wanting to be there for the community that needs it.
Sí, pues señora Elvira, usted es una de mis hermanas, ¿verdad? So,
Muchas gracias. Buenos días.
Sí, entonces, when you called and asked for that, I'm not one to say no to just about anything, so I went ahead and I ordered 600 tests for you, given your willingness to go out there on your own. If your organization is, for whatever reason, not participating, and you come to us and you say, I want to do this, well, con ese buen corazón, te tenemos que ayudar, ¿verdad? So I went ahead and ordered 600, and I'm thinking that that's okay or not okay. I had already ordered some for Poder Popular and Lucha in Santa Paula, and then these would be distributed directly to farm workers out in the field, is what we're talking about. And especially in the South Oxnard area, as dense as it is with farm workers, especially Mixtecos and other indigenous farm workers, then it's very important that we have a large number of volunteers working out in that area. So a question for Sara then. Given that I requested 600 tests, given this situation right now, is that something that can happen?
It can happen. It's just that we are going to expect all the zip codes of the people that receive the tests from you directly. So I would love it if if Elvira and Olga actually call Rodrigo and submit their request so that Rodrigo is able to email you your part of the responsibility. So that would be collecting the zip code from from every person that you give a test to, and then providing that back to us. So CDPH, the California Department of Public Health, is requesting information, and that includes to how many volunteers and staff will be receiving the test, and also how many of the clients, patients, or program participants are receiving the test. So there's a lot of numbers. I don't know if the other thing you can do, Dr. Gavino, is just manage that with Elvira and Olga, have them report that to you, and then you would send that to us.
That's fine with me, yes.
Okay, so just the email correspondence contains all the instructions and what to do in the attachments, such as a report, and also the educational handout. There's a handout that is available in Spanish and in English that tells the person what to do in case the result is positive or negative. So it just, there's the educational handout, there's a report to submit, and there's also the specific information, how many volunteers or staff, and how many are going to actual people in the community. Olga has her hand up.
Thank you, Sarah.
Yes, I'm gonna turn on my, I have a question. It'd be okay if we distribute, because Senora Elvira and I participate in food distributions. You think that's a good idea, or that's a good place to distribute? And how is it gonna work out if, let's say, like you were saying, if the test is positive, and they ask us, how is it gonna, where do we take it, or where do we go, or what?
So-
how is gonna be the process? Because I'm pretty sure that they're gonna be asking us.
Yes, they will be asking you. So if they are positive, the first thing to do is to isolate. They should not be out in crowded places. The next thing to do is that they will have questions for you is about work. So that test will not be enough. I understand for employers, they will want the PCR test. We still have 20 sites throughout the county where they can go to get the PCR test. So this is a different test. It's a rapid antigen test. This one can tell you whether you're positive or negative when your symptoms are strong. And it can detect the virus even when people are asymptomatic, meaning that they do not have any symptoms. Still, so it helps you start taking those first steps on how to protect yourself and those around you. That's what this test is for. If they need a confirmation, then the employer may request for a PCR test. And so as promotoras and community leaders providing education in the community, you are going to feel like you need a list of these 20 sites where they can go to get a PCR test. They can go to the ambulatory care clinics and request a test, or I'm not sure if they do PCR tests, but if they are uninsured, then they have to make sure that they are only going for that, not for anything else. Not for my kidney treatment, not for my, anything else, because then our centers are supposed to be able to request presumptive medical eligibility for just either a COVID treatment, a COVID test, or a vaccine. But if they say, I'm here for this, and by the way, can you also do something else? Then Medi-Cal will not cover it, and they will get a bill at home. They will be billed. So keep it very simple. Your communication to the community should be, here is the test. That is one of the reasons why we like to communicate through the CBOs, because there are certain requirements for the test. This type of test, you cannot do the test for the person. The mom, dad, or a legal parent can do it for the child or somebody who needs that support. But you as a person who's distributing these tests, you cannot read the instructions and do the test for the person. That's number one. You have to have special training for that. Number two, just provide them with the test and say, read the instructions, or you can read the instructions for them, not the instructions that come in the test, but the ones on the handout that we have that comes separately. So if you have the means to print this resource, then that would be great. If you need it, then please let Rodrigo know so that he can print that educational handout for you. That's going to be important. The other thing that is also available on the handout is a way for them to register with the state so that the state can check in with them and provide them with that guidance through their experience as they heal. So with farm workers, if we do not encourage you going into private property or companies. These can only be like at the food distribution where people are out and about in public spaces. If you start collaborating with employers, we want them to contact us so that we can provide them with the instructions. They may not want people from the outside to come into their areas.
All right, very good information, Sara. So I think what we can do is we can move forward with the order that I placed. Once I get the appointment, I'll pick it up and deliver it to Elvira and Olga. And I will ask them to give me the required information. You mentioned you have 65,000 tests, right?
55,000.
Yeah, so I don't know how many have been distributed, but I would suspect that you need additional people to ask for those tests so we can distribute them. Is there a deadline for that, or is there an expiration date on those tests?
Oh, the expiration is until December 27th of this year.
Okay.
Yeah, our timeline is to get them out in the community by the end of this month.
Yeah, okay. All right. Well, we'll do our best.
Oh, you guys do fabulous work. I'm confident that we will do it together.
Yeah. Okay. Elvira and Olga, do you have any other questions? Or Elvira, go ahead.
Dr. Gavino,
Sí, señora.
I would like to get together with you and Olga. Can you please give us a time?
All right.
Do you Do you hear me?
Sí, pues mire, Olga tiene mi número. Olga has my phone number. Why don't you call me right after this call and we'll set something up perhaps for tomorrow.
Sounds good, Dr. Gavino. I really appreciate.
All right. Ya saben que me deben, ¿verdad?
You
Claro
see
que
that?
sí, un abrazo.
Ay,
All right.
Dr. Gavino.
Okay. And, regarding the handout that you shared, Sara, I think that's such an excellent idea,
Yeah.
It provides a script, right?
Mhm.
And it's a script that when you have it laid out like that, when you talk to somebody, you're not thinking, okay, you have a plan, you have a strategy, right? And
Mhm.
then if you go through those questions, and after a while, they've just become part of the discussion. You learn how to do that, and you get better and better at it as you practice. Yeah. So, and then having the on the flip side, having that additional information on questions that might be coming up, I think is very good. So we will be printing those and getting those out as soon as we can as well.
We'll print them for you. We'll have that half-page guide. We'll print it and we can provide it for you. You don't have to do that one. The one that you may have to print some of is a health education handout for the people that receive the tests.
Yeah. Okay. All right. Let me write that down.
Tara, Luis sent me in the chat privately that he's already reached out to our HR director and to our two program directors, the one that oversees all of our Head Start preschool centers and the other that oversees all of our subsidized childcare assistance to families. So he'll take the lead, and if they respond that they would like some of the home tests, he'll contact you or your
Rodrigo.
or Rodrigo. Sí,
Yeah.
Rodrigo. Okay, so we'll let you
Yeah.
know. Thank you.
Thank
Great info.
Thank you.
Okay. I'm glad we worked that out. Thank you. All
Thank
right.
you.
So, so that was my report, Sara. Well, let me share. I'll
No,
share
sir.
some additional information and of course, with the present round of funding for Ventura County VCCF campaign, that runs through the end of May. And so I was asked to, compile some of the data so that we can start working on a final report. So a couple of days ago, I looked through the end of month reports that are submitted by each of our community-based organization partners. And the unofficial numbers are as follows. Regarding interactive activities, which are face-to-face interaction, we actually have a discussion with folks, whether those be on the phone or whether it be door-to-door canvassing or whether it be tabling somewhere or whether it be canvassing out in the community in parks or out by businesses, etc. Then we have reached out to 62,526 people. And this is not the complete picture because we're still waiting for some reports from a few community-based organizations. But with the documents that we have, we've reached face-to-face 62,526 people. We've distributed about 40,000 flyers in non-interactive communications, which include social media and flyer drop-offs. We've reached 382,466 individuals. So, and then as far as assistance with vaccinations, we've done over 6,000 interventions there. So so that just gives you an idea of how we are helping protect the community, and even more than that, we're out there to save lives because this is what it's all about, and not only saving lives, but preventing all the suffering that is that comes along with that infection, all the heartache, all the preocupación, all the stress, so I think at this, given this profile of our status right now, as far as outreach, I think we're doing very well, and we're going to be continuing to do this.
Thank you very much, Dr. Gavino.
Yeah,
Congratulations.
ándele, no, si no es para mí, si es el equipo, ¿verdad? It's the team, you know, Sara
Yeah.
being
It's,
one, CDR, you know,
Yeah.
everybody, you know,
All
so,
organization.
yeah,
Gavino, I think there, what is there, about 35 community-based organizations that were funded, is that correct, or around that number?
yeah, right now we're working with about, on that last round, this is
Yes.
the round that we're actually on right now, there's about 17 organizations.
But the initial one was 35 and now
Oh,
it's
yeah, yeah,
17, right?
yeah.
Yeah,
And
and
then
then,
even-
and
And
those
then even
numbers,
and then even before that, Jack, we were working with over 40 organizations.
over 40, okay.
Yeah.
And then that period you indicated is unofficially is through the end of May, is that correct?
Yeah, it's from, it's just for this last round because the funding that came from the Public Health Institute, they're together toward health funding $100,000. Then they've requested this report and we're doing it, we're submitting it to the county as well. Yeah, the period is from February the 20th to May the 20th. It's a 3-month report. So during those 3 months, that's what, those are the statistics just for those 3 months.
Wow, that's significant, yeah.
Yeah, it is.
Yeah. Great job.
Thank you for
So
sharing.
that, yeah, so that's kind of, you know, my piece of the report. A few questions that, you know, Sara might be able to clarify that came up and at our Monday meeting. One was whether immigrants need health insurance to get a COVID test. And the response was no, it's free. You know, COVID test, there's federal funds that cover the provision of free testing to anybody who needs it, including low income, undocumented as well. Another question that came up, which Sara talked about, is exposure in the workplace and what to do. And if an employer finds out that one of the employees is sick, he is required to report it. And then that individual then can return masked for 10 days. And is that true, Sara? You're muted.
Say the last part.
Yeah, if an employee must report when an individual tests positive or reports that he's positive, right?
Mhm.
So that person isolate themselves for 5 days and then they test themselves again.
Yeah.
And then if they find that they're positive, then they isolate for 10 days.
Yes.
And anybody who has been exposed to that person on the workplace, then they have to all be masked, you know, immediately.
Yeah.
And of course, tested as well, right? So, okay, and then it says the employees can return to work on the 5th day after exposure and if they're symptom-free and have a negative test. So it gets a little complicated, and that's where Olga's questions about, you know, what do you do what does a person do when they test positive, right? So, and then another question was, what's considered a COVID test? And the response to that was, of course, any of the tests having to do with the actual vaccine. There's also a pill, and what else is considered a COVID test, Sara?
COVID test is the PCR and the antigen. So PCR test, approved laboratories can conduct those.
Yeah,
And the rapid test, we can do them anywhere.
yeah,
The rapid test, different from before, from when they were first deployed, is that they can now be used to diagnose.
yeah,
That's the difference. So
Yeah.
we can trust that what the result is true. And so if employers accept that, wonderful. But if they don't, then you have to go do a PCR test, which is
Yeah,
documented, it's timed, it's dated. When you do it at home, it's very difficult to confirm that through a third party. But if you do it through a center or a laboratory, it's very different because you have a document, right? The test results,
Yes.
it's documented. So it's very different, depends what the employer wants.
yeah,
It
All
is
right.
very, it is very complex, Gavino, and I know for CDR, we continually update our return to workplace and our COVID prevention program. We have toolkits and we do a lot of training with staff, but we always have one single point of contact, which is our HR benefits specialist. So that way employees are getting the same information, right? They're not getting, they talk to so-and-so. And so we have really formalized our toolkits to assist all of our employees, but you're right, it's very complex and, you know, into the minutia of the number of days and masking and PCR testing, et cetera. So, yeah. And then we're also doing the weekly PCR testing for those that have, those employees. About 8% of our workforce had approved exemptions. So they're required to get tested weekly under our toolkit.
I think the best we can do is encourage people to talk to their employer
Right.
so that the employer informs themselves if they don't know what the process is or have no experience. We have huge employers here in Ventura County, and we also have very small ones. So I think just letting the person know that it's important for them to just communicate with their employer, their boss, their supervisor, will help them make this, go through this process of healing much easier and faster. You know, just to empower them, I think will be very important.
Mhm. All right, so that, I think that concludes our report. Jack, gracias, Sara.
Great. Thank you both. Great information and conversation. Really appreciate it. The next item on our agenda is Pediatric Vaccine Clinic group discussion. This is a carryover. Luis, did you have any updates related to that? I know we've been talking to other community-based organizations about the possibility of CDR hosting a pediatric vaccine clinic here at our offices in Oxnard. Do you have any further updates on this particular item?
No other updates other than the fact that we're just waiting on when the vaccine will be available. I know Javier Gomez at Enlaquech, El Concilio. I know Gabino had mentioned last month that, you know, we can possibly also reach out to Poder Popular to help us out and collaborate with us whenever we do organize a pediatric clinic for 5 and under at CDR, which is what the plan is.
Okay, great. And we'll engage anyone else that would like to be part of the effort too. So, all right. CBO updates. Are there any other updates? We got into quite a bit of conversation already, but I want to make sure that there isn't anything additional that anybody wants to share.
I have a little bit of information on the Cal State University Channel Islands intern program and their service learning program.
Great.
Yesterday, we met with about 12 people, some of them from CI, and one lady in particular, Georgina Guzman, who is the faculty director, then suggested that, you know, of course, encouraged organizations like CDR and others of our partners to look into providing service learning opportunities for students at CI, which, you know, as we may recall from our own youth, sometimes you don't know what's happening, you know, and so we need to engage these young people that are on the verge of becoming professionals, educated professionals, in community-based activities so that they can learn about, you know, equity and inclusiveness and things like that. So right now I have a couple of people that, a couple of students that are working with me on recruitment for the children's movement. The children's movement being a California network that is pro-child, that encourages and advocates for pro-child initiatives and legislation. And then there's a couple of other students that are working as interns with the Oxnard Performing Arts Center as well. So our plan is to develop a relationship with CI so that here through the foundation, we can have students and we can deploy them throughout the community so that they can learn about the realities of being a professional in the community. So anybody that's interested in getting some of those students to work through a service learning opportunity, then we're in the process of setting that process up through the foundation.
Great work. Thank you for that update and keeping the opportunity alive and actually having some placements. So CDR has also been speaking with Susan from the Martin V. Smith, but more important, in addition to her, Mari Cortez Riojas, who's the chair for the Early Childhood Studies program. So we've been talking to them about other opportunities. And so maybe we'll have an intersection with the context that you've already established. And I know Terry, you had reached out to them initially as well. So that's good to know, Gabino. And we'll see, maybe at some point we'll also be tapping into their students to give them opportunities here at CDR as well.
Yeah, and a shout out to Terry for putting that on the table a few months ago. And
Yes.
So it looks like it's moving forward.
Great.
Yeah, it's great. You guys are moving forward on this, so it's working out really nicely. I appreciate that. That makes me feel really good. Thank you.
Gabino, thank you, Terry. We really appreciate that initial contact and your patience as we were continuing to have dialogue. So Gabino, thank you so much. And if you need any help with the children's movement initiative, Gabino, please feel free to reach out to me. CDR has been a part of that coalition. And then we also have the Early Childhood Coalition statewide. So feel free to reach out to me. If you need assistance, I'd be happy to help.
Oh yeah, I'll take you up on that, Jack, because I always need assistance.
All right. Okay. All right.
A couple
Sarah,
of other updates that I might share.
Oh, sure. Go ahead. Yes.
The Santa Paula Chamber of Commerce is having their community awards event tonight. And two of our partners are being recognized. One is Elvia Hernandez, who is the recognized for her community service as an individual. And also Poder Popular was selected as the nonprofit of the year in Santa Paula in service to the community. So those two, Poder Popular and Elvia, are going to be recognized tonight. And I understand that Sara and some of her team are going to be joining us. So thank you for coming down.
Wow. Congratulations again, Dr. Gavino.
Andale.
Yeah, congratulations. I agree. So I wanted to share during the VCCF Monday update, there was a question about what was the turnaround time from the California Department of Public Health on any application submitted through the All 58 Neighborhood Partnership Grants application process. And I spoke to Leti Alvarez, who is our regional coordinator here in this area. And she said that the turnaround is as quick as 24 hours and that has been the average. She says there's some items that may delay us providing a response, but not a response, but an approval, and that is the insurance documentation only. So she said as long as they have all the paperwork, they will receive a response right away and get a response very quickly.
And what are the amounts available within that grant, Sara?
Anywhere from 1,000 to 5,000. And if you applied once, I believe that you can apply a second time. for a total
Okay.
of 10,000.
Okay, all right.
Thank you, Sarah.
You're welcome.
Are there any others that want to share under updates? If not, I just wanted to, before we adjourn, I wanted to mention that we will have a June meeting. However, I had a conflict on the second Tuesday, so we are moving it to the Thursday, June 23rd. That'll be our final meeting of this group, and I want to be there, so I hope it's okay. We're gonna move it back a little bit, but it'll be our last official meeting as a subcommittee. And of course, we'll hope to get as many people from the committee as possible and celebrate all of our successes together. So,
I'll have some sparkling cider here in my office.
all right. I like the idea of a toast. That's a good idea.
Hello.
Yep. Well, if there's not anything else, I'd like to wish you all well the rest of the day and week and upcoming weekend, and we'll see you in June.
All
Thank
right.
you so much.
Take care.
Thank you.
again.
Bye,
Bye-bye.
everyone. Have a good
Bye-bye.
day.
Thank you.
you.
Have a
Likewise,
nice-
everyone.
Bye,
Bye-bye.
everyone.
Yes.
Thank you.
Later. Bye-bye.
Adios.
Bye.
Buenos días.
Gracias,
Ándale,
Olga.
pues.
Hasta
Thank you,
luego.
Elvira. Bye-bye.
Thank
Yes.
you.